share the screen for diabetes mellitus. So today we'll be discussing about diabetes mellitus, which is a very, nowadays it has become common that majority of the people get it at a later stage of their life. Okay. So it is it is not an inborn error of metabolism. Of course, certain types of diabetes mellitus are inborn errors of metabolism. So this is an error in the metabolism of carbohydrate. Okay, so there is a problem in the metabolism of carbohydrate, which leads to diabetes mellitus. So having given an introduction to hypoglycemia and hyperglycemia, you can understand it much better. So diabetes mellitus in short is called as DM, is a syndrome of disturbed metabolism involving carbohydrate, protein and fat. So majorly it is affecting the metabolism of carbohydrate, but it also affects protein and fat. It results from the degree of insulin deficiency and tissue sensitivity to its action. So there are two problems which actually causes diabetes mellitus. One is your body is deficient in insulin. Your body is not secreting enough insulin. Second is your tissue is not sensitive to the insulin secretion. That is the second case. Okay. So and the combination of these two, combination of insulin deficiency and sensitivity to its actions, brings about distinct clinical phenotypes. And depends upon that, because of this, the severity might change from, you have seen any of your own family relatives or friends, elderly people, you would have seen that it is not the same type in everybody. It varies from patient to patient, the severity of disturbed metabolism, and it is mostly how we monitor is by the checking the degree of hyperglycemia. Now you are understanding what is meant by degree of hyperglycemia. It is nothing but how much your blood sugar level is shooting up. So depending upon that, you can say whether the is highly diabetic or not. Okay. Now, etiology and pathogenesis of diabetes mellitus. So, absolute insulin deficiency, it is called as type 1 diabetes mellitus. Okay. So, where your body is not able to secrete insulin, occurs with auto. Why does it happen? Because it occurs with autoimmune destruction of insulin secreting beta cells. Okay, so your body is not able to secrete the insulin. Why? Because your body has an autoimmune mechanism to destruct the insulin secreting beta cells. Okay. Other than that, congenital means what by birth. Okay, genetic defects in the formation of the endocrine pancreas. So by birth, there is a defect in the pancreas development and formation itself. So the pancreas is not able to secrete the insulin. Or acquired means what? Later on in life you have acquired it. What? The relapsing pancreatitis and pancreatectomy condition. So there is an infection in the pancreas or inflammation in the pancreas where you will have to remove the pancreas, and such conditions also could cause your body not to have enough insulin. So absolute deficiency of insulin action also can occur in total absence of insulin receptors. So this is another reason your body or your pancreas is secreting insulin, but you are not having the receptors. Okay, because insulin has to come and bind to the receptor, only then it actually passes the signal for reducing the glucose level in the blood. So it cannot work unless and until it comes and binds to the receptor. So if there is a problem with the receptor also, it could lead to complications. Now coming to pathogenesis of diabetes mellitus. So relative insulin deficiency occurs with genetic or acquired defects in insulin synthesis or secretions that are inadequate to overcome the resistance caused by fewer functioning insulin receptors. So you are it is called as a relative insulin deficiency, because you either have a genetic defect or an acquired defect, and maybe your insulin receptors are not working, or you have a resistance to insulin action. How? Your body is secreting insulin, but your tissues are not responding to it. Just like how we teach in class at some times, okay, to some students, not everybody. Just like the insulin is being secreted continuously, the tissue is not responding. The teacher is continuously taking class and speaking, preparing and continuously speaking, but the students are not responding. So then what? There is no outcome. Okay. So like that, there is a resistance to insulin action induced by what all? Stress, drugs, and most commonly obesity. So these are the three causes, for example, which can cause a resistance to insulin action. So your body is secreting insulin, but no, it is not able to understand, or it is not sensitized to this particular insulin action due to various reasons. It could be stress, okay, it could be the certain drugs which you take, or it could be a obesity. So the acute clinical manifestations, which means what happens when you are diabetes mellitus, you are diabetic and you are not controlling it, and what happens at the later stages are those related to hyperglycemia. So mainly all these implications are due to a very high rise in your blood glucose level, which exceeds renal threshold. So what happens? Your insulin is secreted, but your body is resistant to it due to stress, drugs, and obesity. Or your insulin is not secreted at all, or your receptors are not working well at all. So insulin does not come and bind to the receptor, so the signal is not carried on. Or it could be due to an acquired case, or it could be a genetic case. All these are multiple factors which could contribute to diabetes mellitus. And then what happens? The blood glucose level rises. When the blood glucose level rises, what happens? Students, when you are learning this, you should actually correlate this and learn. Okay, so you should actually understand that, okay, this happens, then what happens? So this is the reason for this. So this might be the reason why this particular disorder is happening. So like that, make it interesting. It is actually interesting to learn like that, so you don't forget also when you're learning like that. Okay, so what happens is when you're doing this, there is a increase in your glucose level in your blood. When there is an increase in your blood glucose level, what usually the kidney starts filtering? Kidney cannot filter anymore. So it goes beyond your renal threshold, which is 180 milligram per deciliter. Once it goes beyond your renal threshold, what happens? The glucose has to be eliminated through urine. So what happens? Then comes the symptoms. So always in a pathological condition or a disease, the symptoms, whatever you see, has a reason behind. Why you are having a polyuria? Polyuria means what? Frequent urination. There is a reason behind this. There is a biochemical reason behind any of the symptoms of any disorder for that matter. Why is this polyuria occurring? Because there is an elevation in the blood glucose. Your renal threshold is reached beyond that. Your kidney cannot filter anymore. Then this glucose has to be eliminated through urine. How does it get eliminated through urine? It does not get eliminated as a crystal. It has to be eliminated through urine along with water, right? So what? It has to have frequent urination so that you're pushing away the glucose in the blood. What happens when you're having frequent urination? You have increased thirst. This is also a symptom of diabetes, okay? And when you are continuously urinating, and what happens? The body becomes dehydrated. There is a loss of water, okay? And then electrolyte disturbances. When your water is being eliminated, along with that important ions, electrolyte, sodium, potassium, all these are also getting eliminated. So there is an electrolyte imbalance which could lead to certain dizziness and cognitive disabilities. Then what? You have weight loss. Okay, and there is a lot of different metabolic decompensation occurring here, and in extreme degree, that is in acute and chronic cases of diabetes mellitus, it actually evolves into diabetic ketoacidosis, which we will be discussing in detail. What is meant by diabetic ketoacidosis? And this is another one which is called as non-ketotic hyperosmolar coma. Okay, so these are the different culmination of diabetes if it is not treated properly. Now coming to the chronic complications. The chronic complications include which are macrovascular, okay, which means it affects the bigger blood vessels. For example, amputations. But now this is not occurring much because earlier only people did not actually diagnose diabetes much earlier. But now these amputations are very, very less in number because people treat diabetes much earlier so that the wounds are healed earlier itself. Microvascular means it is affecting the small vessels, for example, retinopathy in the eyes, nephropathy in the kidneys, and neuropathy in the nerves. That is why the tingling sensation, it starts with the tingling sensation for diabetic patients. both the acute as well as the chronic. Okay, chronic complications are the diabetic ketoacidosis. Acute complications are the ones which we had, discussed earlier in the previous slide, inversely related to the degree of metabolic control achieved. So if you're able to control the metabolic pathway, for example, if you're able to control the regulation of blood glucose, your symptoms also is inversely proportional, which means it can be reduced. Now, how do you classify diabetes? Diabetes can be classified mainly into type 1 diabetes, type 2 diabetes, and gestational diabetes. Okay, type 1 diabetes is owing to autoimmune destruction of insulin secreting beta cells, leading to insulin deficiency. Okay, so this is what is happening to the very young age. It is also called as juvenile onset diabetes. Here, there is the body itself is having a problem. There is an autoimmune destruction of the beta cells. So what is happening? Insulin is not produced at all. That is type 1 diabetes. Next is type 2 diabetes, which develops later on, okay, at a later age, owing to inadequate insulin secretion. Insulin is secreted but not adequate enough. So that cannot overcome the insulin resistance. Okay. Next is what is called as the gestational diabetes. So that is diabetes which is diagnosed in the second or third trimester of the pregnancy. That is not clearly over diabetes. Okay, so this is not very complicated. Which one? The gestation diabetes. Now these are other other causes of diabetes. One is monogenic diabetes syndrome. Under this monogenic diabetes syndrome, you have neonatal diabetes and maturity onset diabetes of the young. So this usually happens for younger children. Okay. So one is neonatal diabetes and maturity onset diabetes of the young, short form is MODY, and disease of the exocrine pancreas. So these are cystic fibrosis, pancreatitis, pancreatectomy, as we discussed earlier. Because of the the functions of pancreas is affected, insulin is not able to be secreted properly, which leads to hyperglycemia. Then there are certain disorders which are medication induced, okay, because it is induced by the medications which are using, for example, glucocorticoids, treatment, all the drugs which are used for the treatment of HIV and AIDS, immunosuppressants, chemotherapeutic agents, all these are diabetes. Coming to pathophysiology of diabetes mellitus, we know that the former term, okay, during our text when we were studying, it used to be called as insulin-dependent diabetes mellitus, which is your type 1 diabetes, and non-insulin diabetes mellitus is what is called as the type 2 diabetes. Juvenile onset diabetes mellitus or adult onset diabetes mellitus. Okay, these were abolished now. So remember, type 1 diabetes, it is called as type 1 and type 2 diabetes now. Earlier, the type 1 diabetes was called as insulin-dependent diabetes mellitus or juvenile onset diabetes mellitus because it's seen in the young. Type 2 diabetes is the one which develops at a later stage. It was called as non-insulin dependent diabetes mellitus or adult onset diabetes mellitus. So type 1 diabetes mellitus, what are the pathophysiology? So the terms insulin dependent diabetes or juvenile onset diabetes previously encompassed this type of diabetes, and type 1 diabetes results from an autoimmune destruction of the beta cells of the pancreas. So this you should be clearly knowing what is the cause of type 1 diabetes. So type 1 diabetes results from what? Because of the autoimmune destruction of the beta cells of the pancreas. Now, what are the markers to identify? Markers are nothing but you actually check this particular antibodies or autoantibodies in the blood. You are able to, if it is elevated, then you can conclude that this could be type 1 diabetes. So which are the markers which helps you to identify whether the patient is having type 1 diabetes? So these are the several markers of the autoimmune destruction. So during autoimmune destruction, these antibodies are being released. Okay, so then you can actually measure whether these are getting increased. So from that you can actually diagnose. Okay, so this is detectable in body fluids and tissues, which are the islet cell autoantibodies, in short ICAs, autoantibodies to insulin, which are called as IAAs, autoantibodies to glutamic acid decarboxylase, which is GAD65, and autoantibodies to tyrosine phosphatase. Okay, so these are the different markers. Now, pathophysiology of diabetes mellitus. So, despite we increased knowledge, we are still far from understanding. So, even now, we are not very clear in understanding this type 1 diabetes mellitus. So, of course, there are no doubts that genetic factors are strongly implicated, as several genetic factors have been identified. So, it is now almost clear that this type 1 diabetes as well as type 2 diabetes is genetic. Type 1 diabetes is genetically inherited, and type 1 diabetes mellitus, as we discussed earlier, results from what? Cellular mediated autoimmune destruction of the insulin secreting cells of pancreatic beta cells. Okay, and this autoimmune process begins many years before clinical detection and presentation. So it is not that maybe you detect this particular diabetes, type 1 diabetes at the age of 12. It would have started maybe at the age of 6 years. We don't know. Even type 2 diabetes mellitus for that matter. It is not just on that day, okay, I became diabetic. No, it has happened over the years. Okay, so the destruction must be very heavy, as 10 to 20% of the volume of beta cells is sufficient to cover clinical symptoms. So what did we discuss now? We discussed that type 1 diabetes is caused by the autoimmune destruction of the insulin secreting cells of pancreatic beta cells. How much percentage of the pancreas is actually destroyed, which gives rise to the symptom? As we discussed, there could be this destruction happening in your body for a long time, but maybe after it has reached a particular stage only, it shows as a symptom. Okay, so at about 10 to 20% of the total volume of the pancreatic beta cells has getting destroyed. After that only the symptom starts rising. So the rate of beta cell destruction is quite variable. So from patient to patient, how fast it is getting destroyed changes. Being rapid in some individuals, mainly in infants and children, and usually slow in adults, because we know that type 1 diabetes is mainly seen in children. Type 2 diabetes mellitus. It is formerly known as a non-insulin dependent diabetes mellitus type 2 or adult onset diabetes. And it is much more common than type 1. As we know that in most of the families, at least 1 or 2 people are diabetic now. And it comprises approximately 90% of all individuals with diabetes. Means there are different categories of diabetes. Now, if you see all types of diabetes together, if you see 90% of all different types of diabetes is contributed by the type 2 diabetes. The patients are usually older at the onset of disease. So usually the disease comes into existence maybe at the age of 40, 50 or 60 only, mostly present with only minimal symptoms. So insulin concentrations are mostly increased, but they cannot be normal. Okay, so it is obesity is the quite a common factor. That is why at the age of 45 or 40, especially with women, what happens is after the age of between 45 to 55, they reach menopause, and during that state there is a cause of gaining weight, because the hormones are not in the same role now. So obesity is a quite common, and weight reduction ameliorates the hyperglycemia. So during that stage, the metabolic after the age of 40 or 50, you can see that your metabolism itself slows down. Okay, so even if you were eating 3 chapatis till then, when you eat 3 chapatis after 40 or 50, you start putting on weight, because what I have understood that I feel that metabolic rate itself slowly starts slowing down. Okay, so the disease usually develops after 40 years of age, and the group of disorders, of which 2 are most common, represent the new knowledge type 2 diabetes mellitus. So first one is decreased ability of insulin. Okay, so type 2, one causes, insulin is produced, but you are not able to act on the peripheral tissue, and this is what you call it as insulin resistance. And insulin resistance is defined. What do you call as insulin resistance? It is defined as a decreased biological response to normal concentration of circulating insulin, and represents a primary underlying pathological process. This is the main reason for diabetes mellitus. You are having insulin, but your body is resistant to insulin. Okay, you're not responding. Your body is not responding to insulin. Now, second thing is the dysfunction of pancreatic beta cells. So one is your body is resistant to insulin. Second is there is a dysfunction of the pancreatic beta cells, represented by what? Inability to produce sufficient amount of insulin to overcome insulin resistance in the peripheral tissue. So your body is not able to produce more insulin also. So these are two different factors, maybe in combination either or no, both together. So later on, what happens, the insulin production can be insufficient to compensate the insulin resistance due to beta cell dysfunction. Your beta cell itself has become dysfunctional, so it is not able to produce insulin. Whatever the insulin is produced also, the body is having a resistance. So the body is not responding. Okay, so this can lead to hyperglycemia. This is a classic reason for type 2 diabetes mellitus. So the common result is the relative deficiency of insulin. I know that the bell has rung, but I will take another 5 more minutes to finish this. Okay. So a long discussion was held about the primary reason, insulin resistance or derangement of insulin production. Okay. So they were skeptical as to what might be the reason for this. So after doing many studies, the data has supported that the concept that insulin resistance is the primary defect in type 2 diabetes mellitus, preceding the derangement of insulin secretion. Okay, so the first thing what happens is your body is not able to, it is not sensitive to the insulin. That is what is called as insulin resistance. Second is there is a derangement of insulin secretion. So insulin resistance also usually precedes the clinical signs by as much as 20 years. Can you believe it? Okay, so this resistance starts maybe at the age of 20. That is why it is showing up at the age of 40 years. Okay, so the basis of insulin resistance and insulin secretion defect results from a combination of environmental and genetic factors. So these two are also contributing to it. Your genetic factor is a major contribution which you cannot change. Environment factor you can change, the way you live, whether you are living in a very polluted area, whether you are going through a lot of stress. Okay, so all these factors lifestyle changes can be done. Okay, so I think we'll stop with this today. We have done type 1 and type 2 diabetes.